introduction. Get the government out of medicine. Stop Obamacare. This is the title. This is the cover of my book. And Earl correctly pointed out that there's a question mark there, and that this country has a choice to make. Now, in this dialogue about healthcare, one of my favorite authors has made this comment. The first lesson of economics is scarcity. There is never enough of anything to satisfy all of those that want it. The first lesson of politics is to disregard the first lesson of economics. If I was to summarize what I'm going to talk about tonight, it would be in this sentence from Ronald Reagan. Man is not free unless government is limited. Now, we're going to be talking about healthcare, but healthcare is just simply the lens by which we're going to look at freedom and liberty. As Earl said, the perspective I bring tonight is someone that originally believed in government healthcare and then came to realize its moral, practical, economic, and logistical limitations. My goal is to impart to you the failings of Obamacare through the lens of somebody that worked in a government medicine system and then emerged from the socialist trance, as I call it, and saw the truth about how things really should be. What we're talking about tonight, Obamacare, is officially known as the Patient Protection and Affordable Care Act. I would say that that's a very euphemistic term, because I don't think it's going to protect anybody, and it's certainly not going to be affordable. My experience is I grew up in Canada. I was raised in that system. I worked, after I finished my family medicine residency, I did 3 years working as a family physician and emergency physician, and I did my radiology residency and my neuroradiology residency. And throughout that, and then I practiced for a while as a radiologist, and throughout all that time, you know, I believed in the moral justice of universal health care delivered by the government. And I believed that health care was a right, and it was the government's job to ensure that right. I recently had an epiphany about how far I have come ideologically. Having been born, raised, and educated and indoctrinated in ultra-liberal Canada, here I am with fellow right-wingers, educating them on the foibles of government medicine. Now, there's thousands of details in Obamacare, and it's impossible for us to talk about them all. So really what I'm going to do is I'm going to focus on concepts of liberty and tyranny through the lens of healthcare. For many years, I believed in government healthcare, and I've always been an avid reader. And there was a book called Atlas Shrugged by Ayn Rand that I've been thinking about reading literally for years. Fairly early in my career, after becoming director of radiology in Thunder Bay, I started to read this book. And the book, I don't know if any of you are familiar with it, but the storyline is that socialism is imposed upon the United States. And through the course of events in the story, the economy collapses, and eventually, you know, there's no running water, there's no electricity. Civilization is degraded to just a bunch of marauding looters. The main characters in the stories are industrialists. And the goal of these industrialists is they want to bring these various products to market, but every which way they turn, the government is standing in their way. Well, when I was medical director up in Thunder Bay, you know, I had a lot of good ideas about how to improve medical care. And some of them weren't even all that expensive. But every which way I turned, the government was in the way. Meanwhile, I was reading this huge tome of a book. Now, I'm certainly no great industrialist, but I saw the paradox, and I finally got it, that this socialism thing simply does not work. And furthermore, that it is actually immoral because it's predicated upon loss of individual liberty. Now, imagine having a critical narrowing in one of the blood vessels to your brain and having to wait 3 months for the surgery to undo the blockage. Just enough time for it to block off completely. Imagine waiting months for your MRI only to find out that your back pain was caused by a huge tumor or rampant infection rather than a disc problem. Imagine waiting weeks or months for a CAT scan and finding a tumor, and then waiting weeks again for the diagnostic biopsy. Just enough time for the tumor to continue to grow. Are these examples of medical care in Zaire? No, they are not. These are actual medical cases that I was involved in working up in Thunder Bay. Such are the horrors of medical care delivered under the paradigm of Canadian universal health care. Now, the Fraser Institute, based out of Vancouver, yearly publishes data on Canadian healthcare. The average wait time to see a specialist in Canada is 17.3 weeks. I personally knew physicians that had 2-year waiting lists to get in to see them, just for an initial consultation. In Thunder Bay, when I was there, our waiting time for a CT scan was 7 months long. For an MRI scan, it was 13 months long. And we had equipment actually that was actually quite dilapidated and would break down from time to time in the middle of delicate procedures. The province of Newfoundland has had waiting times for MRI as long as 2.5 years. And in Canada, 16% of the population has no access to primary care. That means that your high blood pressure, your diabetes, chronic lung disease, or whatever simply is not addressed until you reach a crisis stage and present yourself to the emergency department. In Thunder Bay, the statistic is more like about 40% of a population of about 150,000. Those are tens of thousands of people that have no primary care whatsoever. In my hometown of Sault Ste. Marie, where I grew up, the waiting time to get in with a family physician for newcomers to town is 5 years. Unless, of course, you have connections with somebody in the medical community. And in fact, I've heard some anecdotal cases in the Kelowna region of British Columbia where there's such a shortage of dermatologists that people have started seeing veterinarians for their skin conditions. Now, the provinces, in response to these types of waits, have set benchmarks on that are benchmarks to be achieved for various waiting times. But true to government healthcare mediocrity in Canada, actually the flattered as mediocre would be a false compliment because it's really not even mediocre. The benchmarks are met only 70% of the time in 30% of provinces. Now, as payer for the healthcare system, government has had a vested interest in restraining the amount of healthcare that's delivered. Nobody has an infinite source of wealth. So if the government is the payer, without having anything to restrain the demand, they've had to put rate limiting steps in how the healthcare is delivered. And one of the primary means by which they did that is about 20 years ago they had a federal commission looking on how do we save healthcare costs. Well, the conclusion of the commission was you need to cut down on the number of doctors. So they started training fewer doctors in Canada. Meanwhile, they turned a blind eye to docs like me that moved to the United States out of frustration. But what happened is the Canadian population has gotten older, just like the American population has, and they've come up with good treatments for heart disease and cancer. So it's possible to keep patients alive with these conditions longer than in the past. Furthermore, in my field of diagnostic imaging, there's been a revolution in imaging with CAT scanners and MRI scanners and PET scanners, which are wonderful diagnostic tools. So the reality is the need for doctors has actually gone up rather than down, and they've driven the supply of doctors down. Per capita, there's about 25% fewer doctors in Canada than there is in the United States, and that's quite a substantial number. And in fact, there are shortages in certain fields in the United States right now, like family medicine and general surgery. So 25% fewer is quite a bit. The American College of Radiology recommends 1 radiologist per 13,000 population. When I was in Thunder Bay for a while there, when I joined, I was the 8th radiologist. The Ministry of Health said to not be underserviced, you needed 13. We had a personnel meltdown. We ended up with 3 radiologists for the region for a total population of 250,000 people. When you're supposed to have 1 radiologist per 13,000. I had very little support staff. I had heavy administrative duties. I was reading half of the MRI scans in the area. For a while, I was doing all of the angioplasties. Needless to say, I was worked to death. But government has had a vested interest in keeping the number of physicians limited. Now, one of my duties as a radiologist there is I would triage requisitions. And when we first got our MRI scanner, we were allowed to run it from 8 in the morning until 5 at night, and we could do about 12 or 15 patients in that time frame, but we would get 25 requisitions a day. So the list was just growing out to infinity. And what I would have to do is I'd have to review these requisitions. There'd be a 1 or 2 line clinical history, and I'd have to make a decision, well, how long does this patient wait? So when people say, oh, there'll never be rationing in government healthcare, well, there was, and I was the guy that had to do the rationing. Needless to say, I had difficulty sleeping at night making those decisions every once in a while I'd get a requisition for somebody that wanted an MRI of their back. The history would be back pain. And then I would personally triage them to the end of the waiting line because back pain is a very mundane problem. And then it would turn out that they had, an infection or whatever that should have been addressed months earlier. And I personally triaged them to the end of the line. Now, in most provinces, to control costs, services such as MRI and CT scans are only available in government-run hospitals. And for the most part, private hospitals are disallowed, although recently there's been some challenges to that. Now, in the name of universality, governments are disallowed from working outside of the public healthcare system. And patients are disallowed from spending their own money to get better service, short of coming to the United States. Any medical service covered under provincial health insurance plans can only be delivered publicly. Now, there's only 2 other countries in the world that operate in such a system where there can be no free market component along with the public system. And those countries are Cuba and North Korea. It's a pretty good guess, if that's how those countries are doing it, that it's not a good idea. And just by the way, Barack Obama has Fidel Castro's endorsement of this plan. He said, we consider health reform to be an important battle and success of Obama's government. Not an endorsement that I would want to have. Now, healthcare in Canada started literally as a one-party payer system. The idea being that the government would simply pay for it. But since the government's not a magical entity with unlimited resources, there was unlimited demand. And so insidiously, the government has taken over healthcare more and more and more in Canada. Now, there's some prominent people in the United States that believe that one-party paired government health care is the ideal way to go. Unfortunately, one of them is the President of the United States. And later on, I'm going to talk about why I believe that ObamaCare, as it stands right now, will be worse than health care in Canada. Now, people easily forget when they think they're getting something for free, that as the government controls the system, there's going to be an attendant loss of personal liberty for both patients and doctors alike. Now, from time to time, I am challenged by people and say, but, look at Canada. They have better outcome statistics. And it's true that Canadians live about 2.5 years longer than the average American. And the infant mortality statistics are actually better. But it's actually a false argument. You have to look at the American population versus Canadian population. The American population is more genetically diverse than the Canadian population. Canadians are more uniformly Caucasian, but not completely. There's a larger black population in the United States, and unfortunately, blacks are more vulnerable to certain diseases, diabetes and hypertension and stroke. And just biologically, when you control for socioeconomic factors, populations of black people do not live as long as white people. It's just an unfortunate fact. On the other hand, Asians do better than Caucasians. Canada doesn't have that, doesn't have as many black people, and like I said, it's more uniformly Caucasian. So that's a bit of smoke and mirrors. And as far as the infant mortality thing goes, it's measured in different ways in different countries. Any baby born alive in the United States with a pulse is considered a live birth. But in Canada, to be considered a live birth, the baby has to weigh 800 grams. And in places like Switzerland, the baby has to be 30 centimeters long. So every country has its different criteria. And again, infant mortality is something that varies a lot by race. I just found out recently that uninsured Hispanics have better infant mortality than Caucasians. So my point is there's geographic and genetic factors that weigh on these things that are outside of the purview of medicine, the practice of medicine. But interestingly, if you factor in deaths in the United States from car accidents and violent crime, Americans are actually the longest lived people in the Western world. But the liberal press will never tell you that. The other thing that they won't tell you is that when you look at individual disease states, such as cancer, prostate cancer, breast cancer, heart disease, look at these individual disease states. People with those diagnoses in the United States invariably do better than any other country in the world and live longer. I think that that's a more meaningful statistic. And interestingly, Medicaid, patients that have Medicaid have worse outcomes than people that are uninsured. So you could actually use that as an argument to say the government should not be financing healthcare at all. Another fly in the ointment is that the United States, up until now, has spent more of healthcare that's been paid through the free market than other countries. Canada pays for more of it through the government sector. And so they'll say, oh, doesn't that prove that government medicine saves more lives, etc. But then look at Singapore. Singapore spends more money from the private sector than the United States, and their outcomes are better. So my point is, it's hard to use, look at outcomes as a meaningful argument one way or the other for government healthcare. You've probably heard this information that the World Health Organization says that the United States is 37th in the world in healthcare, just behind Costa Rica and just ahead of Slovenia. Well, actually, you know, if you read the report from the World Health Organization, there's a little bit of information that the liberal press neglects to mention. That when it comes to access to physicians and medical care, the United States is #1. But the criteria by which they make those conclusions of where to rank countries is based on the degree to which they're publicly government regulated and government financed. So it's just meaningful information. The most important thing about healthcare is that it's not about statistics. It's about caring for patients. And I'm going to give you an example, a personal anecdote. 6 years ago, New Year's Day, I was busy taking down the Christmas decorations. I don't like to see them after the holiday season is done. So anyways, it was a cold day and I was out there for about 3 hours. I had one more task to do, and that was to get the wreath down from above the garage. So I laid up the ladder, scurried up the ladder to grab the wreath. The ladder slipped. And as I was flying through the air, I got to make a decision. Am I going to land on my feet, or do I hold on to the ladder and end up, you know, landing on my face? Well, fortunately, I made the decision to land on my feet, but I broke both feet. And in fact, I pulverized one foot. The navicular bone was broken up into probably about 100 pieces. It was the orthopedic surgeon said it was the worst fracture he'd ever seen. He showed it at Twin City Orthopedic Rounds, and they agreed this was the worst navicular fracture they'd ever seen. Something you don't want to have. But the relevant point is, the orthopedic surgeon wanted a CAT scan, so we got a CAT scan on my foot. And it nicely laid out the anatomy. You can see that this was pulverized. It was pointless to put screws and pins in there, and he figured if he tried to do that, the whole thing might just crumble. So he opted for conservative management, put me in a cast, and I've actually done very well, and I have pretty limited disability from the whole thing. But my foot is still hurting and probably will for the rest of my life. 20 years from now, when my foot's still hurting, I can live with the reassurance that I had the best care possible because I got that CAT scan. But the CAT scan costs some money. But it was not worthless. And so when people talk about we're spending too much money, you've got to put it in proper context. And some of that money was actually well spent, but maybe had no effect whatsoever on longevity statistics or any kind of measurable statistic. But it did improve quality of life. Much of what I do as a physician, and what most physicians do, is we improve quality of life. The idea that we're day in, day out intervening in people's lives and saving them from the brink of death is a fallacy. I have saved people from the brink of death in my career, but they're relatively few and far between experiences. But nonetheless, I do believe that I add quality to people's lives. In the United States, we're spending about 70% of gross domestic product on healthcare as opposed to 11% in Canada. One thing people forget to mention is that there's significant medical research in the United States more than anywhere else in the world, and that's part of that 17%. In Canada, they have price controls on drugs, and the manufacturers can only charge a very small profit above the production cost. So the end result is there's virtually no new drug research in Canada. Whereas the entire amount of money spent in Canada on drug research is smaller than that at Texas A&M University. So high spending is not necessarily a bad thing. And does it make any sense that ostensibly Barack Obama is trying to bend the cost curve down in healthcare? On the other hand, he's bailing out the auto industry and the financial industry? It absolutely makes no sense whatsoever. If you think about healthcare, a lot of the money that's spent there is on things that people want. They're getting questions answered, having their pain mitigated, getting their procedures done. It's not all necessarily bad. We will talk a little bit later about why things are as expensive as they are later in the talk. Now in Canada, the whole system is largely predicated on price controls. And in every province, there's a fee schedule designating how much it is for a minor office visit and that type of thing. I'll give you an example. There was a procedure I used to do up in Canada called peripheral angioplasty. Patients would have narrowings in the blood vessels in their legs or to their legs, and you know they'd walk and they'd get pain in their legs. And what I would do is I would thread a catheter up their blood vessels, stretch out the narrow blood vessels, alleviate the obstruction, and improve their symptoms. And it was actually quite cost-effective and simpler and easier on the patient than an open operation. Now, for a while, I was the only doctor up there doing the procedure. And when I said I was going to move to the United States, the vascular surgeons had a fit because they realized they had nobody to refer to, and it was 500 miles to the next major medical center. Now, why would no one else do it? I mean, there were some other doctors there that had some training, but they refused to do it. The reason was the reimbursement was so low, and it was about $90. And my goal is not to plead poverty, but for $90, of which half of which I paid in taxes, you know, I was assuming millions of dollars of potential liability. So it actually made sense for people to not do it. And that's the effect of price controls, is it creates shortages. But it doesn't necessarily actually save costs, because these people that couldn't get the procedure done would then either have to have an open procedure with time off of work, with hospitalization and major recovery time, or they would have to travel to another center to get the procedure done. So there was actually no net savings. But keep in mind that not just angioplasty is under a fixed price control, versus the whole system is. And so that's one of the reasons why you see shortages. Now, just to give a comparison, last winter I was having some difficulty with my snowblower. It was $99 just to get the guy to look at the thing before even, I mean, I'm not disparaging, you know, the role of people that fix snowblowers, but I just don't think it was quite equitable. And I used to do a procedure called facet injections, where I would use x-ray guidance and I would put a needle into precise locations in people's spines and inject medication to alleviate the inflammation, and it paid $14. And they wouldn't pay you to do the other side at the same level. And it got to the point where we literally said, we cannot offer this service. So anyways, the whole system is based on price controls, but I've got news for you. The current system in America is based on price controls too. The American Medical Association administers the CPT codes, which are a billing code used to set Medicare prices, and then based on those Medicare prices, the private insurance companies adjust their rates, but it's ultimately based on price controls. And that's one of the reasons why we have problems here in the United States as well. In 1920, Ludwig von Mises correctly pointed out that socialism could not work because it neglected all of the information that would occur when prices are set in a free market. And he was exactly correct about that. Now, unfortunately, ObamaCare is going to reinforce the status quo on price controls on both medical services and insurance. And I submit to you that ObamaCare is not reform at all. It's simply a reinforcement of the status quo. If you look at food production in the Soviet Union, it had some of probably the most arable land of any country in the world, and yet people starved in the Soviet Union. And the reason for that is prices were not set in free market. There couldn't be a coordination of information between various people involved in the production process, and so things simply couldn't get done. Now compare that to access to food on Manhattan Island. It's my understanding on Manhattan Island, 24/7, you can get any type of food from anywhere in the world. And the reason for that is because there's no price controls and it's not centrally planned by government. There's no central planner, and you have this wonderful abundance, and there's no farmland in Manhattan either. And yet, because of prices, deliverers of goods and whatnot can coordinate their functions so that people get what they want. Now, in Canada, just like Obama, government thinks that it's smarter than the marketplace and can rationalize distribution of resources better than the marketplace. A really stark example hit me this about 5 years ago. My brother was very sick in hospital in Canada, and I had to, it's just an amazing story, but he had been sick for about a year, complaining of these symptoms. And I was getting very worried about it. And in fact, things started to come to a head when he was on an airline flight and he landed and the ear wouldn't clear. And that went on for months. I thought, that is very unusual. That is actually a classic presentation of a nasopharyngeal carcinoma, which is a very rare carcinoma in Caucasians. And anyways, he couldn't get the necessary imaging done and whatnot. Got sicker and sicker. Well, finally on Christmas Day, and he had small children at home. He just couldn't take it anymore. He presented himself to the hospital. He had terrible pain. He couldn't get an MRI done, which would be the definitive diagnostic test, because it was a Christmas season. And the way it works up there is the MRI scanner closes at 5 o'clock on Friday, and that's it. No matter if the scan would reveal life-saving information. Well, anyways, he ultimately got the MRI done because my parents were down there. My dad has a very forceful personality. And he managed to get it done on Boxing Day, which is the day after Christmas in Canada. Well, the report came back that he had sinusitis, and this was called me and said, he's only got sinusitis, but the symptoms didn't fit. I got on the plane, I told him at work I have to leave on emergency basis. Got on the plane, flew there, and I read my brother's own MRI and diagnosed his own massive cancer in his nasopharynx. And then he waited about 35 days for his emergency radiotherapy. Now, it was interesting when I was visiting him in the hospital lobby. There's a chain of coffee and donut shops in Canada called Tim Hortons, and they're incredibly popular, and I wish I had stock in them. But they have a little kiosk there, and you can go there 24/7 and get a cup of coffee and a donut and a nice sandwich. But the bizarre thing was, you couldn't get the health care you needed. And yet Canadians were blind to the fact that here was a free market for coffee and donuts that was thriving, meeting people's needs, unregulated by government. And yet when you needed an emergency MRI in Canada, you couldn't get it. It's just bizarre, and it struck me as odd that Canadians just don't see that. Now, when I was working up in Canada, we were just insanely busy. And I said to the hospital, you know, we need this device called a rolloscope, where we can have a clerk load the x-rays on this machine, and I can push a button and go from case to case to case, and facilitate reading large volumes of x-rays. Well, the CEO of the hospital said, well, you know, we've expanded our global budget for the year, we have no money. Perhaps you can make your case in the Ministry of Health. They're about 700 miles away. So anyways, contacted the Ministry of Health. 3 years later, the radiologist in Thunder Bay got their rolloscope. I was long gone by then and moved to the United States. Well, then the rolloscope collected cobwebs for another year because they realized there was no money in the budget to have a clerk load the film. I came to the United States and working in Twin Cities, I started working in one of the hospitals in the metropolitan suburbs. We're getting busier and busier and busier. We said to the hospital and our radiology group, hey, we're getting busy. We need to have a rolloscope facilitating reading large volumes of x-rays. We had it in a month. Now, why the difference in the experience? Well, the difference in experience is because in Canada, the hospital and the Ministry of Health are operating from a global budget. When the money's done, that's the end of the service. In the United States, with the vestiges of a free market here, the purchase of a rolloscope was seen as a wise investment to make more money for the hospital, make more money for our radiology group, provide service to the community, deliver prompt service so that we have credibility and would be competitive against other hospitals. It made sense. And that's where a free market is working better. Now, you got to keep in mind, the Ministry of Health isn't just figuring out, you know, whether or not to spend money on rolloscopes. They're trying to figure out how much money to spend on a multitude of things. You know, how much money is going to go to emergency departments in different hospitals? How many nurses are going to be trained? Public health programs, you know, cancer programs, you name it. The likelihood that they're going to get the exact right blend of allocation of resources is pretty unlikely. It's just not going to happen. There's no way that a few bureaucrats can be smart enough to come up with that allocation of resources. The only thing that's smart enough to do that is the composite knowledge of all of us together functioning society through something called the free market. I was just reading one of Thomas Sowell's books the other day, and he made a really good point that even if you assembled a group of experts that are the absolute pinnacle of knowledge in their field, they still don't know as much as we all do as individuals about local circumstances and conditions and where it's wise to spend money. Now, it's very difficult to predict complex events. And take the weather, for example. It's very hard to predict, and the farther out you try to predict, the less accurate you're going to be. Theoretically, if you had enough data, you could punch them into some complex equations and predict the weather. But the problem is, if you're off by even an infinitesimal amount, by even one measurement, your prediction is going to be way off. Now, the economy is a complex system as well. And yet government functions like it can input the data and make it work to predict an end result. But that's very, very unlikely. In fact, while healthcare is a very large segment of the economy, and yet the government believes that it can plan these events and not only just predict them, but control them. And it's just not going to work that way. Let me explain. About 25 years ago in Canada, it was decided that 65 doctors would be trained in radiology per year. In 1848, Karl Marx wrote the Communist Manifesto. And one of the premises of the Communist Manifesto is that government could decide the correct allocation of various professions. that they could plan the needs of society and figure out how many butchers and bakers and candlestick makers and whatnot there would be. Well, the reality is there's millions of occupations more than that now, and how are you going to plan that? And the Soviet Union attempted to do so with 30 million bureaucrats. And the net effect is that hardly anything could get done, progress ground to a halt, and people starved. And eventually the economy imploded. Now, enormously overburdened with work and armed with the insight of the statist nature of healthcare in Canada, and no longer wanting to cooperate with it, in December 2000, my wife and I decided to move to the United States. And I was very crestfallen when I found out that the immigration process would take about a year. So when I said I was going to leave, there was only 2 other radiologists. One of the other fellows said, well, if Lee leaves, I'm leaving too, leaving 1 radiologist. And some of the other specialists started to say, well, if we only have 1 radiologist, we can't really do things here properly. I'm going to leave as well. And so the net effect is that the events, 25 years ago, when they said there's going to be 65 radiologists, resulted in potentially devastating consequences 15 years down the road in a different geographic location with the potential implosion of Thunder Bay Regional Hospital. That's what the mathematicians and the chaoticians refer to as the butterfly effect, where little events can have profound effects on events further separated in time and space. But like I say, the government isn't just planning how many radiologists there are. They're planning how many physicians are in all different areas. They're planning how many nurses there are, how many operating rooms to run in a given area. The likelihood that they're going to strike that balance just right is extremely low. The truth is that the economy, including healthcare, doesn't have to be made to happen. It needs to be allowed to happen through spontaneous events. And despite the failure of central planning and price controls for both insurance and individual medical services, ObamaCare is based on central planning and price controls. The very things that have been proven to not work. Obamacare does not break free from the status quo, it's a reinforcement of the status quo. Legislators at both the state and federal level insist on using central planning to solve healthcare problems. And these are the different central planning models that have come into fashion. Electronic medical records is a means of central planning and figuring out where resources are going to go. Preventative care, it sounds great, but it's just another form of central planning to decide where the money should go. Managed care, medical homes, that's something they talk about in Minnesota. Baskets of care, resource management, coordinated care, comparative effectiveness, research, pay for performance. I could talk quite a bit about each one of these, but I don't think we'll have time. The point is they're all forms of central planning and they're going to result in no favorable outcome. Now, the mother of all central planning, buried in ObamaCare, is what's called accountable care organizations. And Jane Orient, executive director of the American Association of Physicians and Surgeons, a conservative free market medical organization, has described HMOs as, accountable care organizations as being HMOs on steroids. And I agree with her. And the idea with HMOs is that, say you get pancreatic cancer, and you go to some doctor at some hospital and clinic chain. Well, with that diagnosis, a lump sum of money is going to go to that organization. Then the doctors within that organization are going to have to fight it out amongst themselves who gets paid what. But the worst thing about it is that the profit that the doctors make, their take-home pay, is going to come from what's left over after all the money has been spent on caring for the patient. So there's a huge conflict of interest here where the money is made by denying care. And I think it's a really potentially serious problem. Okay, so if centralized control doesn't work, decentralized control does. Just like it does for tires and electronics and all sorts of things. There's no centralized control, and yet there's no shortage of those things. Where the control needs to lie is within the hands of each of 309 million Americans, 850,000 doctors, 2.5 million nurses, and 5,818 hospitals in America. And when the decision-making power is put in the hands of all those people, the chaos of the free market will unfold, order will arise, and there'll be prosperity and abundance. The chief Medicare actuary, Richard Foster, has estimated that Obamacare is going to cost $222 million over 10 years. That's the most conservative estimate I've seen. Usually I'm seeing numbers more in the order of $900 billion, which is the net worth of 900,000 millionaires. Now, I'm not an economist, but this graph scares me. If you look at, these are the unfunded liabilities for Social Security and Medicare and the debt. And the orange block there shows the escalating debt on these unfunded liabilities. It looks like disaster to me, and throwing Obamacare on the whole thing is not going to save any money. And what's going to happen with Obamacare is it's about 45% of doctors are saying they're going to quit. Because what happens with government pay is oftentimes it's not enough to cover the delivery of the service. And so we're functioning at a loss. And doctors are saying they're going to have to close their door. On the other hand, you're going to have 34 million new uninsured people. Demand's going up, supply's going down. And so you're going to have waiting lists here, just like we do in Canada. And it's interesting to look at the situation in Massachusetts, which is basically a state-based version of Obamacare, where they've instituted a mandated insurance. Doctors are leaving the state. It's now 90 days to get in to see a family doctor. Costs are higher than ever, and the state's requiring a bailout of billions of dollars from the federal government. Who's going to bail out the U.S. federal government when Obamacare starts to sink it? Under government health care, people sometimes have this assumption that, well, the right people were getting the care. But I told you earlier about, triaging these waiting lists. It was impossible to be sure that the people most in need were actually getting the care they needed. Milton Friedman talks about in free societies, by and large, people get what they want, but whereas in governmental systems, people get what some bureaucrat says they can have. And I was forced into the position of being that bureaucrat, saying what people could have. And I was very uncomfortable with that. Basically, I was being forced to play God. Now, the net effect of government health care is that it doesn't actually deliver health care. It actually impedes health care. And you need to take the bigger pictures and say, okay, what would exist in the free market? And when I'm up at Thunder Bay, many people that I know think I'm crazy. But they'll say, look at this new hospital that's been built in Thunder Bay, this beautiful structure. Well, look at what would exist if it wasn't all paid for by government. You wouldn't just have this one radiology department with a monopoly on MRI and CAT scan services. You'd probably have 10 in that area competing against one another, keeping the prices down. Earl mentioned ManyBid, and we've got this interactive web portal for buying and selling medical services. Well, people are getting MRI scans for like $350. But if you go for an MRI scan, the hospital is going to submit a charge of about $2,000. So if you let the marketplace work, it does work, and it will bring down prices. In August of 2009, Dr. Ann Doig, incoming president of the Canadian Medical Association at that time, said that Canadian healthcare is sick and imploding and not sustainable. And despite all of the evidence that government healthcare is a failure, the Obama administration insists on going down this path, even when the majority of Americans now don't want it. Now, there's an interesting controlled experiment going on in Canada because the dentists dodged a bullet up there. They're not part of the government healthcare system. And yet there's no shortage of dental services in Canada, and the prices are reasonable. And I used to see one dentist, I thought his prices were a little bit high. I went to the guy down the street, got a better price. It works. Now, one thing that people need to understand is I'm certainly not defending the status quo here in the United States right now. The American system of healthcare is already very much a statist system in that we don't control the majority of dollars spent on our own healthcare. Some third party does, whether it be the government or an insurance company. And remember, it wasn't a free market that set it up so that you didn't control your dollars. It was an act of Congress that said that the doctor bills the insurance company or the government rather than you. So it was the government that pulled you out of that transaction between doctor and patient in a fiscal sense. It all started back around World War II with wage and price controls. And what employers wanted to do is they wanted to compete for good employees, so they couldn't increase salaries. So instead what they did is they started offering health insurance. And the norm was established that we got our health insurance through the employer. Right up to first dollar coverage because they wanted to attract people. And yet that's a very unnatural situation, so that now when you lose your job, you may lose your insurance as well. The other problem is with having first dollar coverage, too much is covered. And in a sense, we're overinsured. The normal function of insurance is to replace large unexpected financial losses. That's how it works with house insurance or car insurance. You know, if your house burns down, that's when your insurance kicks in. But it doesn't kick in for floor wax or renovations or that type of thing. And if it did, you know, people would be getting their kitchens renovated every 6 months, and house insurance would be astronomically expensive. And yet we have to remember that health insurance, as it stands right now, for the most part, is not insurance, it's prepaid medical care, and that's why it's very expensive. It's predicted that under Obamacare, premiums are going to go up, probably in the order of 20%. And what's going to happen is, employers are going to start dumping people from the plans, the insurance plans. More people are going to go to the government exchanges that are going to be established. And the government will set the terms on what is in those insurance plans. On the other hand, the insurance companies, the private insurance companies are going to be squeezed because they're going to be limited on what they can charge. So it's going to drive insurers out of business, which I think is part of the agenda to decrease the free market and ultimately drive us all into a government plan. Just last week, the Principal Financial Group based in Iowa said that it's dropping healthcare coverage for 840,000 people. And I'm sure that that is just a start. I'm sure there's going to be more of this. So much for President Obama's claim that if you like your insurance, you can keep it. When American Medicare was introduced back in the 60s, more than 90% of the elderly people were successfully covering their healthcare costs. Unfortunately, government, in its insatiable quest to dig deeper into our lives and control us, designed the program to cover everybody over that age. And in its supposed benevolence, it wanted to protect people from the indignity of having to say that they needed charity. Now, prior to the inception of Medicare, the elderly were paying about 20% of their yearly household income on health care. In the year 2000, for which I have statistics, the elderly were paying 19% of their yearly household income on health care. An insignificant difference. And yet, on the other hand, these people have paid into Medicare their whole life. So the reality is the true cost for medical care for the elderly has gone up rather than down under Medicare. And where is the evidence that Obamacare is going to save any costs? There is no evidence. Let's see here. I'm just going to back up a little tiny bit here. Now, people tend to blame the so-called free market in the United States for the problems in healthcare, and in summary, it's very much a statist system. 47% of all costs for healthcare in the United States are paid for by government. It's actually 56% if you count the health insurance plans to government employees. So that's hardly a free market, especially when you count the 1.3 million pages of federal regulation on the delivery of healthcare through hospitals and clinics. More government isn't going to solve anything. Now, currently, 85% of the U.S. population is insured. And why destroy the 85% that's working, where it's working fairly well, just for this 15% that are uninsured? And yet that 15% is very misleading. 46 million are uninsured at any given point in time. 10 million of those people, or maybe 12, are illegals. And even in ultra-liberal Canada, you do not have access to public programs if you're in the country illegal. Because you're in the country illegal. I'm sorry. I'm getting ahead of myself. 12 million are illegals, 14 million qualify for government programs, 18 million are earning greater than $50,000 a year, and 10 million are earning greater than $75,000 a year. The true hardcore uninsured is probably more about 8 million. And those are primarily made up of the working poor. Now that 46 million is also deceptive in the sense that 5 months from now, half of those people will be insured. So it's a rolling number. It's not the same people that are uninsured at all times, that 46 million. And part of that problem is that health insurance is successfully tied to employment. I don't lose the mortgage on my house if I lose my job. I don't lose my car insurance or homeowner's insurance if I lose my job. So it's health insurance should be something that we own privately. Now, why is insurance expensive? Why do people often not buy it? Well, in many states, there's something called guaranteed issue, where you can't be turned down once you're sick. And unfortunately, that's a feature of Obamacare. And the penalties are such that it may make more economic sense to just pay the penalty than buy the insurance when you're sick. In many states, there's something called community standard, where all 40-year-olds have to pay the same amount for health insurance, regardless of what their health care status may be, or whether they're smokers or alcoholics or whatever. And in many states, there's mandates on what needs to be covered. And there's an insane degree of regulation driving medical care costs. I mentioned the 1.3 million pages of federal regulation. Unfortunately, ObamaCare reinforces all of these things rather than breaks free from them. Now, one legitimate problem is the pre-existing conditions. Now, I'd like Ann Coulter's point was that we need to look at the insurance system so that insurance is cheap, address those problems that drive up costs, so that people have insurance before their pre-existing conditions even exist. It's a good point, but even still it's a problem. One thing that I tend to favor over federalization of this whole issue is the state-run pools for people that are uninsurable. And they have that in Minnesota, and my understanding it works relatively well. I'm not a fan of government programs, generally speaking, but I would much rather see a government program that's closer to the people at the state level rather than at the federal level. Let me see here. Now, invariably, what you're going to see as insurance companies are driven out of the business, the opponents of our viewpoint are going to say the free market is failing and that we need government single-pay health insurance, when the root of the problem is the government in the first place. Now, we've all seen how free markets work, dropping prices for things like televisions and computers. Markets work, socialism doesn't. Why does it cost tens of thousands of dollars for an American woman to have a hysterectomy? Both ovaries removed, and a hernia repair. Whereas my dog had exactly that surgery, and it cost me $550. The reason it works is because veterinarians work in a free market, and American physicians don't. And incidentally, in the community of Guelph, Ontario, population 80,000, where my brother lives, there's no MRI in that community. In fact, when he got sick, he had to go to the next town over, because he knew there was no MRI in town. There's no MRI for people in town. But there is at the local veterinary college. So a few years from now, after the implementation of ObamaCare, don't be surprised when your dog gets better medical care than you do. Now, everything I've talked to you tonight is true. But they're mechanistic utilitarian arguments about how it doesn't work. Now, as long as there's people out there that see healthcare as government healthcare as noble and just, they're going to insist on persisting with it, no matter how much of a failure it is, because they believe that it's noble and just. But what we need to do is defeat it at its root, which is that there is nothing noble about it, and that it's not moral or just. It's inherently based upon coercion. Someone must provide it, someone must pay for it, and must be delivered under government terms. And basically what you're saying when healthcare is seen as a right, you're saying that you have a right to another person's property and labor, which makes no sense. Now, this is an amazing anecdote. In the summer of 2002, there was a highly publicized incident where a patient died. There was no physician available in the emergency department, so they had to transport the patient to another hospital where there was a physician available. I mean, that is mind-boggling. No physician in the hospital in the emergency department. Anyways, the patient died. So the premier of the Minister of Health in Quebec basically declared martial law on doctors and said, you will work when and where we tell you to work. And what would happen is emergency physicians would be finishing up their shifts, they'd get home, and they would actually be given a subpoena saying, you must work at such and such a hospital, it's 300 miles away, your shift starts in 12 hours, and if you don't go, you're getting a $5,000 fine. Now, when the government is the payer, it's pretty hard to not cooperate. It's just amazing that such Gestapo tactics would actually exist in modern-day North America, but it actually happened. Now, fortunately, the rule of law prevailed, and the emergency physicians challenged it in court, and they won. But the very fact that it would happen demonstrates that government health care is based on coercion. And it would be no different in the United States. Now, I couldn't get the Patient Protection and Affordable Care Act as a Word document. I want to do a word count on the number of coercive terms in it. I had it as a PDF, I didn't have it as a Word document, so I couldn't do that. So anyways, I'm going to make reference back to the Clinton Health Security Act of 1993 and tell you the type of words that are in it. Prison shows up 7 times, penalty 111 times, fine 6, enforce, 83, prohibit, 47, mandatory, 24, limit, 231, obligation, 51, required, 201. Unfortunately, the Republican counterproposal was also based on forcing people to do what the government believed to be the right thing. Prison was used once, enforced 37 times, penalty 64, fine 12, prohibit 19, required 482. You get the idea. The point is, it's intrinsically based upon coercion. I'm sure that Obamacare is no different. I'm sure there's a lot of those words in the 2,000 plus pages of Obamacare. Now, the fact that healthcare is seen as a need is often confused with it being a right. Now, the American Revolution was the high watermark in recognizing rights in the true meaning of the word. Now, a right is a sanction for free action. There's no obligation imposed upon anybody. And if you read your Bill of Rights in the Constitution, they're all negative in the sense that nobody is required to provide you with anything. John Locke looked at us as beings that had ownership of our lives. And as owning our own lives in the American system, we were free to trade with others the fruits of our own labor. You've got a chicken, I've got $1. I'll give you $1 for the chicken. The reason I'm doing that is because I want the chicken more than $1. You want the $1 more than you want the chicken, so we make a trade. We're both winners in that transaction. If we don't like the term set, we go deal with somebody else. So every side of a transaction, there's winners. And so you have this infinite cascade of such transactions occurring in the capitalist system. People got wealthier and wealthier and wealthier. The net effect is the United States became the wealthiest, the most happy and prosperous nation in the world. And I would say the most moral because it was based on freedom. Now, the Soviets tried a system based on the negation of individual rights, and look at the results. It was universal despair. Freedom is a concept that you need to understand, and it's a political concept. It means freedom from the coercion of other people. The idea that a hungry man is not free is absurd because it confuses the concept of political freedom with the biological fact that we all have needs for food and shelter. Now, at times capitalism gets a bad name, and the reason for that is there can be artificial winners and losers through special privilege granted by government. And these special privileges can occur with price controls, wage controls, restrictive licensing laws, legal monopolies, and that sort of thing. Now, Ayn Rand wrote in The Fountainhead about a just capitalist society in which men exchange their work by free mutual consent to mutual advantage when their personal interests agree and they both desire the exchange. If they do not desire it, they are not forced to deal with each other. They seek further. This is the only possible relationship between equals, and anything else is a relationship of slave to master or victim to executioner. So the choice is either voluntary trade or external coercion. And Obamacare is ultimately based on coercion. Now, constant with the theme of voluntary trade, I've been involved with the development of MediBid, which is an interactive web portal for buying and selling medical goods and services. Let's say you need a knee replacement. You can go online, register, give some basic health information, specify what you're looking for, and specify the geographic radius that you're willing to travel, whether it be locally or worldwide. Any doctor in the geographic radius that you specify that's registered can make a bid. And you'll see all the bids, and you can choose based on price, value, and location. And what we're trying to do is create a true free market. And nowadays, with the internet, markets could work even better than ever because we have so much information available and we can bring people together from diverse locations. Medical tourism, and our slogan is the marketplace for medicine. Now, medical tourism is something you may have heard of people leaving the United States to get medical care elsewhere for better prices. And Deloitte Development estimated that by the year 2017, even before ObamaCare was devised, 15.7 million Americans were going to go overseas and spend $228 to $600 billion a year on health care. Now, interestingly, at MediBid, we found that if doctors and clinics are allowed to compete and set their own prices, often they're very competitive. I mentioned, the $350 MRI scan in the Twin City area. Well, we have some orthopods and whatnot. You'll see these numbers about, heart bypass, $130,000 in the United States, Thailand, $11,000, Singapore, etc. Those are massively inflated prices. The doctors in the hospitals don't see anything like that. ObamaCare went on TV and said doctors get $50,000 to amputate a limb, so they have no vested interest in preventive care. Well, it's nonsense. It's about $600 a surgeon gets for an amputation. But knee replacements, we're seeing knee replacements through MediBid rather than the standard price of $40,000, $11,000 in that sort of range. So the marketplace will work if you let it. And when the patients see the standard US rates, they think about going overseas, but actually potential exists for inbound medical tourism where the Americans can be just as competitive with these places overseas. Oh yeah. I'm going to tell you why I think Obamacare is going to be worse than Canada. When I was functioning as a physician in Canada, there was basically just two bureaucracies that I dealt with. There was the Ontario Health Insurance Plan, which paid for the services that I rendered. And there was the Ministry of Health, which basically controlled resources and whatnot. This is a simplified version of Obamacare. In fact, the complexity has been reduced by about 2/3 for this diagram. And if you notice on the far side, the little star there's the patient, and over here is the physician. And we've got all this bureaucracy between them. It's unfathomable that that's actually going to make things work better. I just can't grasp that. When the Canada Health Act was enforced in 1984 and formalized in their system of government health care, the individual provinces had been experimenting with it for many years before that. The Canada Health Act was 13 pages long, and it basically ruined health care in Canada. Obamacare is over 2,000 pages long, depending on what font size. In my computer, I've got a 906-page version, but it's just a smaller font. Now, what are some of the other negative effects? We're going to have an insurance mandate, which has been shown to not work in Massachusetts, and it's effectively a tax. And Obama said no new taxes on the middle class. It's going to expand the pool of people with prepaid medical care, thereby escalating inflation, demand inflation for health care. And as I mentioned in Massachusetts, the number of doctors has gone down, the demand's going up, the supply's going to go down. So you're going to have waiting lists here. Performance measures. Physicians deviating from a standardized performance measure will be financially penalized, creating an obstacle to providing medical care for complex and costly patients. If you were to look at a disease like diabetes, there's a spectrum. Some cases are pretty simple. Some are very complicated. The more complicated ones are going to be harder to treat and more expensive. And it's going to create a disincentive for doctors to provide service to those people. Doctors are going to be penalized for providing necessary care. A term that the government likes is so-called never events, when you amputate the wrong leg or take out the wrong kidney or do a heart transplant on the wrong patient. I can certainly see why you'd never want to do that. But they've expanded the definition to things that are really not necessarily physician control. Like, for example, if the patient gets a urinary tract infection from having a catheter in, they're calling that a never event. And yet, it's an inherent risk of having a catheter. And in many times, the benefit of the catheter outweighs the risk. So again, they're imposing an obstacle to providing correct care as if physicians have ultimate control over individual physiological responses. Premiums are going to go up, conservatively 20%. It's an unaffordable entitlement. We mentioned that before. And physician shortages. Now, if complex legislation won't work, what would? Simple ideas would work. And I believe that in the press, we didn't hear enough about these simple ideas. Putting you in control of your healthcare dollars rather than the third party would work, so that you shop for price and value. And the people providing the service are accountable to you for the service that you get. Health savings accounts are a great idea, but unfortunately in Obamacare, he's making it harder for us to use a health savings account. In fact, if you want to just go buy a non-prescription bottle of Tylenol, you're going to have to get a prescription from your physician to do so, which is going to radically drive up costs. It makes no sense whatsoever, and it's a restriction on our freedom. Along with health savings accounts, we need high deductible insurance plans, so insurance functions with its true purpose of replacing large unexpected financial losses. We need to look at tort reform, so that doctors are not looking over their shoulder every way trying to prevent a lawsuit and over-investigating and over-treating patients. Every hour of every day that I work, I see tests that were discretionary and didn't necessarily have to be done and could have been overridden with just a little bit of clinical judgment. But because it's all paid for upfront through insurance plans, and because of the threat of lawsuits, the sky's the limit on the use of health care, even when it may not necessarily be appropriate. For example, if you have a headache, a careful clinical examination in history for most cases of headache is adequate to rule out a serious cause. Yet invariably, when patients come to our hospital, they get a CAT scan at the very least, if not an MRI. We need to allow people to buy health insurance across state lines so that we geometrically magnify the competition. Obama wanted to have a public plan that you could buy from the government, and his argument was, well, we want to add the public plan to be competitive with these private insurance companies. But that's utterly ridiculous. One public plan competing against all of the insurance companies in America, break down those obstacles across state lines, and you're going to increase competition 100-fold, if not 1,000-fold. By the way, Medicare facilitates purchase of health care across state lines, not just health insurance. Vouchers for the poor is an idea that's been floated out in some states, where rather than having them get money on a prepaid government fee schedule, they just give them for the money as a voucher, like a food stamp, to be spent only for medical care. Health savings accounts within Medicare would be a good idea. In fact, I just read a really good idea about, one thing you could do is when a person is young, they could pre-fund their Medicare in a private account, let it grow and expand, so that when they're old, they have access to that money. Now, my ultimate choice would be to see us completely the government completely out of the healthcare business altogether. Medicare and Medicaid really are socialist programs. But that may not be palatable to the average electorate, so we need some kind of a bridging point where we can incorporate free market measures within Medicare to get people used to the idea of controlling their own money and starting to see it less as an entitlement. We need to get rid of rules like community standard and guaranteed issue. In fact, because of community standard and guaranteed issue in New Jersey, health insurance is more expensive than the lease on a Lamborghini. So, you can see why people forego getting health insurance. The truth is, a little bit of tweaking could fix the system or make it far better than it is. We'll never produce a utopia, but it'd be far better. And yet, what ObamaCare is based on is like using a tank to solve a problem that would be fixed with just a screwdriver. We need to get rid of Obamacare completely, not just modify it or replace it with some, quasi-governmental system of the Republicans. We need to get rid of it completely. Repeal would be great, although I think it's unlikely that we're going to see that happen as long as we've got a Democrat president. If the Republicans do well in the upcoming election, they could defund it. And there's only over 25 lawsuits challenging it right now. And one of the bases of the lawsuit is whether or not the mandate is constitutional. I'm not a lawyer, but I don't see one word about health care in the Constitution in the limited and enumerated powers of the federal government. To me, it does seem constitutional. Unconstitutional. So what can we do about this? Well, after the election, contact your newly elected representatives, government representatives, and tell them how you think. All of my representatives know exactly how I think. But I don't think Al Franken really cares. Now, government is not a magical entity. It can only finance a scheme such as government health insurance with your money, with confiscatory taxes or deficit spending. The fact is, healthcare, whether free enterprise or government, is paid for by you. Only the people can generate the wealth necessary for such a scheme to work. Government creates no wealth. If government could merely wave its magic wand and create the wealth necessary for such a plan, why doesn't Sudan do it? The reason they don't do it is because they don't have enough wealth, and the reason they don't have enough wealth is because they haven't embraced capitalism as they should. The proponents of universal health care advocate that they implicitly saying that they don't respect your ability to decide where your own money goes. Government health care on the surface seems to be imbued with the milk of human kindness. And the reality is, it's a malevolent idea which wants to strip you of your rights and make you dependent on government. This is not being done for us, it's being done to us. The advocates of ObamaCare want the government to decide the type, amount, and quality of health care that you receive as a patient and that doctors are allowed to deliver. It wants to strip people of the right and the freedom to decide where their own money goes. Communism, like universal health care, was a system based on the loss of individual rights. They controlled people's rights by controlling the economy. And ObamaCare is set out to control a huge segment of the economy. As Friedrich Hayek pointed out in The Road to Serfdom about 50 years ago, once the government controls the economy, they've got you, and you've lost all of your freedom. Americans and Canadians alike have lost lives fighting against tyrannies like communists and Nazis. And yet I fear that Americans are going to squander their freedom and willingly hand it over to the likes of those that want to impose government programs on us like ObamaCare. More than 40% of all revenues in this country now go through government. Therefore, more than 40% of the government economy is directly controlled by the government. Almost everybody would agree that the communist ideal of 100% is a bad thing. So why is 40% okay? With the institution of government ObamaCare, 17% more of the economy will be under government control. How can this possibly be a good thing? Will the Cold War have been fought in vain? Will the United States end up flying the hammer and sickle after all? Nikita Khrushchev himself said the United States will eventually fly the communist flag. The American people will hoist it themselves. Let's hope he's wrong. This is from the cover of the Communist Party platform, and within it, it says they advocate complete cradle-to-grave social insurance coverage, including all medical care. Vladimir Lenin himself said that socialized medicine is the keystone arch of the socialist state. If ever the American people become comfortable with the government determining the type, quality, amount of health care that the government allows them to have, the very fabric of this country will have been undermined, from one that embraces life, liberty, and pursuit of happiness, to a country of servile wards of the state. The American Revolution was a revolution for individual freedom. The further socialization of healthcare will undermine the achievement of the American Revolution. Ladies and gentlemen, you have the good fortune of having been born into the greatest nation on earth. The only nation to have ever embraced that was ever formally based upon the ideas of rights and liberty. In order to defeat the vicious idea of government health care, you must be aware of the meaning of rights and liberty, and that you're entitled to both. Barack Obama said on his campaign website, mistakenly he said, on health care reform, the American people are too often offered two extremes. Government-run health care with higher taxes, or letting the insurance companies operate without rules. I propose to you that the more meaningful dichotomy is externalized control versus individual freedom. It is very tempting to be wooed by the sense of safety that government health care delivers. But let's remember what Benjamin Franklin said to us and warned us. Those that give up essential liberty to purchase a little temporary safety deserve neither liberty nor safety. Thank you.